living on planet Earth is for sure wonderful. At the same time, it means that we are overwhelmed by the force of gravity. Think about that. We don't have varicose veins on our arms, but we do have them on our legs. And it is because we actually evolved from quadrupeds to bipeds, so now being overwhelmed by this force of gravity, so leading to hydrostatic pressure overloads that can create dilations, varicose veins, and symptoms. So in this lesson, we will have a look at the data we recently published on Journal of Vascular Surgery, Veins and Lymphatics, and on International Angiology. So you can have a little look at this little lesson, but at the same time you can read everything inside the two papers. I do feel that organizations like the Venous Lymphatics World International Network, not-for-profit organization, and at the same time all the scientific societies dedicated to venous and lymphatic diseases should really put some order in the mess there is out there in terms of commercial claiming that whatever stocking can actually do something, particularly when there is the claim that the stockings can aid in performance and improve blood circulation. Indeed, we are living in a time in which it's easy to have fake news, also in graduated compression stockings. So we really want to put an accent in what is really certified and what is not, and what these certified products can do or cannot do. What has been demonstrated so far is that, for example, if we take a marathon athlete running for 10 kilometers with 25-35 mm mercury, the lower limb volume of this athlete will remain the same rather than increasing. At the same time, in such a long run, graduated compression stockings at this pressure level does not seem to be really effective in changing the symptoms perceptions. If we look at the meta-analysis of the data we have, what we can see is that there is a little bit of a mess because many products were put together without being 100% sure that these products were certified, and so putting together, let's say, apples and oranges. So that with this bias, we can conclude that the only thing we can really say, looking at all the literature available over there, is that compression, a graduated compression, can actually improve the delayed muscle soreness onset. So again, delayed muscle soreness onset can be actually present if we use compression. But if we use compression, something more can happen. Particularly in chronic venous disease patients, it was demonstrated that at different speeds in velocity, a good compression around 21 mm mercury can actually improve the residual volume fraction of about 20%, so leading to a better drainage of our lower limbs. And this effect is associated to a dose-response mechanism for which 23-32 mm mercury performed better than 18-21, that perform better of no compression, in particular in fastening the venous emptying of about 45%. This very elegant study done with electromyography demonstrated that, again, the dose effect is present in compression, so 30 mm mercury were able to positively impact the triceps sura fatigue, better than 18, better than nothing, of course. We also know that activating the muscle pump is increasing the velocity of the venous return. So knowing all these things, knowing that it is good to activate the muscle pump, and knowing that compression could be good, what should we say to our friends that are asking us if they should go walking, if they should use graduated compression stockings, and in case, which compression level? To answer to these questions, we designed this study in which we invited 10 physically active healthy volunteers with a mean age of 33 years old and a normal BMI to perform an ultrasound checkup to be sure that there was no chronic venous disease. We had them coming, for example, on a Monday, walking for 30 minutes in a standardized way, and by standardized way I mean 70% on the individual estimated maximum heart rate. This was the group A, and the walk was done without stockings. Then, 7 days after, they came back and they performed the same, but with stockings at 20-30 mm mercury. I named before the formula we used, which is the Tanaka's formula, that is, again, the maximum heart rate, calculated as 208 minus 0.07 per rare the age, so to have a standardized way of assessing this walk. And as I was saying, they came back 7 days after, and of course when we use compression, As we always suggest and pretend actually when we are reviewing or submitting papers, we use an interface pressure measurements device to know what kind of compression stocking we were using. The lower limb volume was assessed by circumferences measurements with a truncated cone formula of Kuhnke, which is a validated formula, as it is a validated score, the one we use to assess the perceived exertion. So the scale ranging from 6 to 20, known as the Borg scale, where 6 is no tiredness and 20 is the maximum effort you can sustain. The pressure we assessed in the product we use was 24.6 mm of mercury as mean value. And what we noticed was that when a subject is walking for 30 minutes in a standardized way, the lower limb volume remains the same, while this lower limb volume is decreased by 5%, so a significant decrease when the subject is walking with these pressure values. But even more interesting, the Borg scale is significantly decreased in the group using stocking, moving from 14 to 11. So a positive impact in the perceived exertion by using stockings at that pressure level, ranging from 20 to 13, in particular 24 mm mercury more or less, can be beneficial for our perceived exertion. So that's what we can say now to our friends asking us if they should go walking and if they should wear a pair of graduated compression stockings. But what if these subjects want to go walking with their dog? So stopping and going, stopping and going. What is the difference between an intermittent and a continuous? No. Up to our knowledge, there is not so much evidence over there, apart this investigation that is dealing with multiple sclerosis patients, so not really an investigation on vascular patients. So for this reason, we performed an investigation on the golf courses, and we randomized the use of sham versus 18 versus 23 mm mercury without the subjects knowing what kind of compression was used. Of course, we are not the same at the whole 1 and the whole 18. We have been walking for quite a long time, and we are, of course, more tired. So also in this case, we use the Borg scale to evaluate the performance of these graduated compression stockings. And what we saw, again, is that, interestingly, even if we activate the calf muscle pump for 18 holes, which means more or less 10 kilometers, which means more or less 5 hours, our lower limb volume, despite the activation of the calf pump, will not decrease. Rather, it will increase because it is more the time in which we are standing up, waiting for shooting the ball or waiting for the other friends of ours to shoot the ball, which is actually the same model that we are enjoying when we are walking downtown. We stop in front of a shop and then we start again and then we stop in front of a shop. If we use 18 mm mercury, our lower limb volume will remain the same. If we use 23 mm mercury, our lower limb volume will significantly decrease. Now, the interesting thing is that in this investigation with the placebo and blind assessment, what we saw was that just a group with 23 mm mercury significantly decreased the perceived exertion. And it's interesting to notice that we used also stockings that were just sleeves, so not covering the foot. And what we saw was that there was no difference in terms of lower limb volume variation and in terms of the perceived exertion. So, of course, with the bias of combining two studies together, what we demonstrated is that in both cases, intermittent walking or continuous walking, around 23-24 mm mercury can be the optimal solution for a lower limb volume decrease and an associated perceived exertion decrease. The answer, of course, as always, has to be found in the lab, with translational medicine moving from the lab to the clinic and vice versa. But we have also to be extremely cautious because despite there are some few data out there about the cytokines and the biomarkers, the models that have been used are extremely poor. We don't just simply stand up. As we said, we activate the muscle pump. So we have to be really cautious what kind of model we are using in our study design. We have to be really cautious in the timing in which we are poking the vein to harvest the blood, to collect the blood. And at the same time, we really have to be cautious if using the blood is the right choice rather than using the urine, for example, that is able to collect biomarkers faster than the blood sometimes. And for this, I really suggest you to enjoy the wonderful lessons taken by Professor José Diaz from the University of Michigan in this series of video lessons that we are creating with the Venous Lymphatics Ward International Network Foundation. Indeed, we are really interested in basic science also. As you can see, we are literally down on our knees collecting data, and we hope that very soon we will be able to disclose the data we are now collecting. We will briefly disclose this interesting data about the lower limb volume decrease with the use of stockings, and as you can see, there is basically a negative linear trend between the lower limb circumference and the interface pressure variation. So this is telling us the importance of a proper prescription of the graduated compression stockings. With proper graduated compression stockings, what we demonstrated in this study that is now under submission for publication, so I hope soon you will be able to enjoy that also on an index journal, is the fact that when you are walking with graduated compression stockings, differently from when you are walking without graduated compression stocking, you can enjoy by bioimpedance analysis also a decrease in the extracellular fluids, so really pushing the edema inside the venous circulation, so getting rid of your edema. At the same time, we analyze the same patients standing up, walking, and sitting. And what we demonstrate is that in all the cases, healthy controls and also patients can enjoy a graduated compression stockings, in this case of around 20 mm mercury, significantly decreasing the lower limb volume with a bigger effect when they are both sitting or standing, but also when they are walking, as we saw at the bioimpedance analysis. Again, all these data can be found in the publication that soon will be reported on the Journal of Vascular Surgery, Veins and Lymphatics, so I really invite you to have a deeper look at all the data. And I invite you to also enjoy the document we produced after the Winter International Meeting in Phlebology, Lymphology and Aesthetics, where world-renowned experts gathered together to glide on the guidelines, bringing evidence on also the graduated compression stockings topic, particularly bringing evidence of the importance of not comparing apples with oranges, so always knowing not just interface pressure measurements when you are assessing performance of stockings, but for example also the stiffness rather than the lower limb shape of the patient, because this could change the performance of the stocking. So stressing out the importance of graduated compression stockings in helping venous and lymphatics drainage as long as they are certified, of course, stockings. It was also our pleasure with the vWIN Foundation to create a group dedicated to this topic, the Phleborto Forum, where now orthopedics and phlebologists are talking together for proper prescription also in orthopedics. So again, all these topics will be found on Phlebology Journal, dedicated supplement to the Winter International Meeting. So I hope you will have the chance to enjoy that. Thank you.